Okay, the topic that we're going to cover in this session is how to move a patient who already has a cervical collar in place, move to a backboard. Some of the equipment you're going to need is a long backboard, a roll of tape, some head blocks, a cravat can be used, at least 4 straps, whether they're speed clips or spider straps, whatever your jurisdiction uses, and a couple blankets as well. We don't need a C-collar for this because it's already applied to the patient. Some things to consider when treating the patient and mobilizing them during your assessment is the Maryland Trauma Decision Tree on page 132 in the Maryland Protocol book, as well as on page 28, according to Maryland Protocols, on the C-spine rule-out. This will help you determine exactly what type of treatment you're going to use for the patient and how you're going to package them. Some of your decisions as you're doing your assessment and as you're applying the C-collar is your destination. We gotta stop. Okay, now we're going to go through and demonstrate how to move that patient who has been had a cervical collar placed on them, how to safely move them to a long backboard for transport. We have 4 rescuers. One rescuer is going to maintain control of the C-spine manually. That person will have control and will count each time we move the patient, so that way he's at the head, he or she can see the whole patient from top to bottom as we move him or her. The providers on that side of the patient are going to roll on the person at the head's count. When they roll that patient over, they're going to roll him or her over, to make sure they go just beyond 90 degrees. I can sweep the back and check for injuries, but rolling them over beyond that 90-degree mark also allows for good placement of the backboard under the patient, so when they roll him back onto the board, the patient should end up in the middle and results in less need for repositioning the patient once they're on the backboard. So on your count, we'll roll the patient over.
Okay, roll towards you on 3. 1, 2, 3.
I slide the board into place, do a quick sweep, checking for injuries, and anything else that I may see is out of the ordinary. Place the board up under the patient. On the person at the head's count again, we're going to roll back.
Okay, roll to the board on 3. 1, 2, 3.
All right, so if you roll back, the patient should end up in the middle. Now, a couple things here. We have the blanket in place. 1 is for patient comfort. 2, we can use it to reposition the patient if they have to be moved up or down. C-spine control has manually been maintained the whole time. As well as the blanket is going to help pad any voids. Now we're going to secure the patient using speed clips. So we'll make sure we make a couple X's on the patient. 1 to secure the upper portion, make an X-ray across from the chest, to make sure the hips are secure, padding any voids as we go. Again, constantly assessing the patient and taking making all those decisions as we go along as far as patient destination and how we're going to get into that facility. So we're going to crisscross on the pins on the board here. You want the straps secure enough and tight enough so that the patient's not going to move, but you don't want to restrict any breathing ability of the chest here to expand. Each provider has to make sure that the straps are not twisted. Again, make sure we take slack out to the point where they are not super tight, or it's going to cause any more injury than benefit to the patient. If the patient does not line up properly on the board, to where we can't get the X's where we need to place them, you can take an extra strap and go directly across the hips as well to secure it. The main goal we're trying to achieve is getting the body secured to the board so that anytime the board is moved, whether in transport or reassessing the patient or changing something, the patient does not move or slide, causing the cervical spine to be out of alignment. Once the body is secured, we have one provider that can start securing the patient's hands. We do not put them under the straps because we put the straps directly on the patient as much as we can. They can secure the hands so they don't move around freely. We're going to take a set of head blocks, place them next to the head. Take a roll of tape. The board has to be lifted, so if you want to take the C-spine control for him, the person at the head can now lift the board. One of the easiest ways to do this is take one continuous piece of tape onto the board. Keep the blanket out there. Go around the head, securing the forehead. I'll trade you. I'm going to hold the blocks. One continuous roll of tape around the whole board. ensures there's enough length. If you're working in rain, or there's any blood or anything else wet that may interfere with the tape sticking, one continuous roll or piece of tape ensures that.
Okay. Down, 1, 2, 3.
Patient secure, go back and do your reassessment. As with any patient, we'll recheck our pulses, motor, sensory, keep them covered, maintain body temperature, load them on a stretcher, and transport.